using more of a physical means. But in that situation, I would have to say that not every situation of deafness, obviously, is cured through an adjustment. But in that situation, it was a physical obstruction of some sort in the neck, and so that we have a lot of cases like that that can be relieved and solved through physical means of adjustment, and you know, from musculoskeletal to also visceral too. You know, the biggest things that I've seen is changes in people's digestion, heartburn. I've seen you know, middle ear infections go away. I've seen a lot of just improved wellness, well-being, better function, being able to work longer, more energy for people. So so this is basically how, and I'm going to explain why that is, why that connection is, why chiropractic can help relieve some of these things. Because a lot of people would know chiropractic as, oh, someone's just popping your joints. How could that possibly, like if you pop your knuckles, right? How could that possibly help your health, right? But chiropractic is a little bit different. The noises that we get are not exactly what chiropractic is. It's sometimes the joints do make noises, sometimes they don't, and some techniques, our adjustments are not for the purpose of making those sounds. But most people associate that with chiropractic, and what we don't. The number one thing is that the misnomer is that we treat pain, that we treat back pain or neck pain. Chiropractic is not a treatment for pain. What we do is try to balance the body physically through balancing the spine. And so the spine, if you notice, is in your back. And when the spine is unbalanced, the first thing that starts getting tight, tense, and a little painful is your back. So there's that association with back pain. And so a lot of times the back pain will start to be relieved. Sometimes it's not, because sometimes there's a lot of degeneration in the back that can't be reversed. So for us to say we treat back pain is not exactly 100% accurate. So what we're doing is creating balance, and we're helping the body heal itself, because when the body's balanced, it knows what to do. It heals itself through the connection of the nervous system, you know, because the nervous system is within the spine. And so that's actually what we're influencing, is the nervous system and the nerves that are coming out at each of the levels. And so let's go on to the next slide. And so we talked about a little bit about alignment, and alignment can mean a lot of different things. And I just like to think of it as balance and motion, having your joints in alignment so that you can have optimal motion. Because when you're not moving, the body tends to materialize more and more and more, and there's less energy in that area. So what we want, to me, alignment means normal motion. So what causes the body to go out of alignment? These are the two questions I'm going to answer today. And what does it mean when the body is out of alignment? So when the body is out of alignment, we have a term for that at a specific area in the body, and that's called the subluxation. You see, a dislocation, we've all heard of, is like a dislocated shoulder that comes out of the socket, right? This is a little different. Sub meaning less than, the prefix. Luxation is, you know, a kind of a dislocation, but it's just enough to cause a disturbance. The joint is still connected, but it's still altered, and it's altering other things in the body that relies upon that motion. And so here we have the yellow part is the nerve, and in between every vertebra there's a spinal nerve that comes out and innervates that part of the body. And so the spinal nerves, 10% of the spinal nerves are what we feel, sensory input. 90% is function. So we don't feel function. It just happens in our body. So when there is a subluxation, there's not necessarily pain, because sometimes it's there for a while until you start to feel pain. So the most important part, and why we influence the function of the body, is because 90% of the nerves in our body are influencing function. And so what we want to do is get the pressure off those nerves. So this is what another picture of a subluxation. It could be a forward movement of a vertebra or a backwards movement. It could be a side to side or a rotation. So there's all these different ways that the spine moves, and we can be injured in a number of different ways, and we can be subluxated in a number of different ways. So this is a picture of a normal spine. This is a osteoarthritic spine, and all that means is osteoarthritis. There's different types of arthritis. So there's example is rheumatoid arthritis. That's more systemic. It's not positional. It's not like a wear and tear. It's an inflammation process in the body, in the joints, because of not a physical problem, but it causes physical symptoms. Osteoarthritis is different. It's from wear and tear. So there could be an accident, and then your body healed a certain way, and now there's more wear and tear over time at that area. So that's what osteoarthritis is, and they call it also degenerative joint disease, but it's the same. It's just a different name for it. So when there is a subluxation, when there's a hindrance in the motion of a certain area of the spine, it's more likely to produce wear and tear in the body, because every time we move, we run, we walk, energy is translating up and down our body throughout our spine, and if there's an area that's not moving properly, that energy gets stuck there. It's not going through that area. So that's why over time, because of wear and tear and gravity, we have these different changes. The bone starts mineralizing in different ways, and we call that spurring, bone spurs, and the disc space gets narrower.
Yes, doctor. When it's caused by an accident, then it requires surgery, right?
Not in every situation.
Really?
Yeah.
That's fascinating to know.
Yeah, because that's why we do what we do. Is we try to help people without surgery. I mean, surgery is always there, but we try to do everything non-invasive first. And a lot of times that can help. If you can go without surgery, then that's much better for you, right? There's a lot of risk with surgery. My dad just was in the ICU for a month because of a surgery, and it was a normal routine surgery, and he had a complication at the end of it. So and it wasn't from the surgery itself. It's just a complication. So yeah. So really recently. Yeah. So that if we can go do whatever we can, like nutritionally, meditation, exercise, chiropractic, massage, acupuncture, to do everything we can non-invasively before we get to that point where we need that surgery. And we help educate people that, when they go to the doctor will tell you, okay, you need this surgery, but you don't really know you have other options until you meet people like us that that educate and promote this type of stuff. So, but it's just a process of getting the word out there more and more. So it's just another picture of the vertebra that's in the lower back. So also in the spine, we talk about balance, and everybody thinks they should have a straight spine, but you should know we have natural curves in the spine, and the curves are there for a reason. They help with shock absorption, because if we're subluxated, say in this area, it's going to affect that area. Or if you're injured and it heals differently, it's going to affect that area, and there's going to be less of a normal curve there. And if we have less of a normal curve, obviously we're going to have more tension there over time. It's going to produce more problems. So we have to understand we have natural curves in the body, and if we have optimal motion within our spine, those curves are going to stay healthier. So this is another picture of the hole in between each vertebra where the nerve comes out. So this is a normal space, and that's what we should have in a healthy spine. There's another picture of it. It's important to see that, to understand chiropractic and understand what the adjustment actually does, because this is what we're affecting. We're affecting increasing that space, increasing that energy to flow through that nerves. So it's important to kind of see each vertebra stacked up like a block, but also in between that space where that nerve is coming from. So when you talk about the subluxation, medically we address 5 different components of the subluxation. These are the medical terminology for it. I'm not going to go over that, so I've made it easier, and this is the layman terms for the 5 components of subluxation. So remember, subluxation is something that's off its tracks, just like a train. You know, it's a little bit off its tracks, so it's going to limit your range of motion. That's number 1. Number 2, it's going to, because you have, if there's a limitation of motion, the muscles that are trying to move it normally, they're going to be in spasm too. Number 3, that hole between the vertebra is going to be compromised, so that the nerve is going to be interfered with. So, you know, it can have problems with, you can start to feel pain, but also you can have trouble with different visceral problems. And this is the line of chronicity. So what that means is that 1 to 3 can be easily reversed. It's not a problem. Through getting the joint moving again and proper nutrition and exercise, this can be reversed. But when it's chronic enough to be there for so long that the bone starts making changes, we can't really reverse that part. We can help manage that part, but we can't reverse. Some people say they can, but you know, it's much longer process. It's harder to prove that you can reverse such changes. So the goal for chiropractic is to get to people before they start feeling these irreversible changes, to help them reverse these subluxations, to help them maintain good balance, strength, and flexibility and motion. So the subluxation of the vertebra occur in all parts of the spine and in all degrees. When the dislocation is so slight as to not affect the spinal cord, it will still produce disturbances in the spinal nerves passing off from the foramina. Now this was written by a neurosurgeon, and I think that's a great thing because 50 years, I mean, it was always a problem when chiropractic first started, is that we didn't have medical doctors on our side. They were just not believing in what we do. But that's a great thing that actual neuro.
Give me a second. I'm just gonna get him situated.
Okay, no
step back here. This is Mark. He's the regional sales rep for Health Force Nutritionals, one of the top supplement companies that you can find at Whole Foods. And he has a lot of free goodies for us and a great talk coming up after Alex is done. So I just want to give you guys a heads up of who's here. Stash
Right.
stuff, I guess.
So I just wanted to put that in there. Just it's a great thing that a neurosurgeon actually is acknowledging what a subluxation is. Here's another definition. Basically, that's the number one thing that chiropractors do, is that we locate subluxations, we adjust them, we get them back to normal motion. These are some x-rays of a normal neck in phase 1, 2, and 3 of degeneration over time, basically losing that curve. And so your neck is healthy when it has a nice curve, when the disc spaces are when there are good space between the vertebra. And so these are some of the changes that happen in the neck. So also posturally, it affects the way we sit up normally, because if we have a normal functioning neck, it's much easier to have a good posture. If your neck or spine is off or subluxated, then it takes a lot more effort for you to sit up straight or stand straight or work at a working station. The thing about our working station is that you have to understand that sitting in a chair working with a good posture, it takes 300 times more pressure for your back, 300 times more effort for your muscles to keep you in an upright position when you're sitting. So that's why people slouch. It's just a normal thing, because we get tired. It's it's a lot harder to sit up straight over time. So the thing is, that's why we're not meant to sit. Our workstations, everybody working on the computer is not that great. But I'm glad a lot of people are shifting, and companies are shifting to standing stations. And when I was in the ER or the ICU, I saw the nurses all had stations where they would sit and stand. So they, the actual computer would go up and down. And so I think that should be incorporated in every corporation. I mean, you got to look at what works, and we'd have a lot less injuries on, or chronic wear and tear sitting at computer stations. The key is movement, though. If you can sit half the time, stand half the time, get up and just do a lot of stretches, that's the best thing. If you stand all the time, it can also be bad. You got to change it up a little bit. That's the key, is motion. So that's just phases of degeneration. That's something that all of our spines go through. It's not something to fear. It's just, but as if we know this sooner in our life, we can prevent a lot of it by nutrition. Number one is the food that we eat, and everything that we're doing nutritionally, exercise, movement, and when we do, because we move our spines all the time, we do different things with our bodies, we tend to get subluxated. That's just a fact of life. And everybody pretty much has a certain level of irritation in the spine. That's because we use our bodies, and that's okay. And so what we figured out with chiropractic is that we can help release a lot of that tension. And people can go their whole lives without getting adjusted. That's fine. And feeling some irritation, getting used to it. But it can be much easier on you when you get that adjusted, get that relieved, and have better motion in your spine. You'd have less degeneration over time. I'm not here to scare you to say that if you're not getting adjusted, you're definitely going to wind up like that. That's false. I'm just saying that if we can all take care of ourselves better, and chiropractic is one aspect of doing that, we'd all decrease the amount of degeneration on our spines. Is that fair?
Yes.
So just different pictures of what that degeneration is. So what is a what causes a subluxation? And that's stress. Stress can be in a lot of different ways. So emotional, psychological, mental stress, that I equate to, stress on the job, or stress, at school, or, relationship stress, all kinds of stress. Those stresses do translate physically in our body, because we carry ourselves differently when we're going through things. So that needs to be acknowledged, and if you have a good way of dealing with that, you can relieve a lot of that physical stress on your body. Chemical stress, you guys are no strangers to what kind of food that's out there that we're eating, the GMOs, the pesticides, the chemicals that we're, so it's important to educate ourselves through what Vadim is doing, through what you guys are doing, to understand what we can do about it. Certain things that we can't change, but certain things, small things that we can do that can change, that can make a big difference for us. Physically, that's basically where I come in, and I've talked a little bit about that. Physical stress equals musculoskeletal stress. So for me, just to keep it simple, there's two types of physical stress. There's macro trauma, where there's basically an injury or an accident. A lot of stress in a small amount of time, right? So that's gonna, dislocate a shoulder, or strain a joint, or, rupture a muscle, and then the body's gonna really protect that area and start I call it nature's cast. It's gonna go into spasm and really protect it from further damage. And so micro trauma is more common. I don't know, more common, but more people experience it through their workstations, through anything that you do repetitively, even driving a car. How often we drive in the car, we get out a certain way, we shift a certain way, we push the brake and the gas a certain way. So that all adds up. That can affect your hips, that, over time, if you're not taking care of yourself, stretching, exercising. So these patterns start being created in the body. So when we're talking about an actual physical stress that causes a subluxation, a lot of people in the beginning stages, they feel that in the muscles, so they don't feel the pain right away when it's a repetitive issue over time. It just feels tight, tense, the neck is not moving as normally as it should, shoulders are stiff, and it's normal to think that, oh, okay, that's just my muscles, those are my muscles, okay, I'm just gonna get a massage and it should help. Sometimes that fixes it, but most likely it's not that simple, because the muscles are attached to the bones, which make up the motion segment unit, which has ligaments, muscles, tendons, and so if that stress continues to be there and come back even after the massage, it's more likely a structural thing, where it's what we call a subluxation, a joint problem. So the way we fix that is through adjustment, getting it corrected, getting it back on track, getting it moving better. And then when you get the massage and when you get the other treatments, you get a better response, because you're not fighting against the tension in the joint. So in that respect, I believe that chiropractic massage, it should work together, but sometimes when people just go for the massage, massage is always great. It's great to have someone giving you that attention, but unfortunately it's not going to fix every musculoskeletal problem. We need a combination of the two in most cases. So I talked about that a little bit. So what is the solution is basically the solutions are always going back to the basics. When we get too complicated, we find that it's harder to keep up those activities. So number one is always, what's keeping us alive is our breath. Clean air, clean oxygen. Learning how to breathe again. Most people don't know the concept of, oh yeah, I should learn how to breathe better. I should breathe better, but it's just things get lost and you go about your day. But it's important to sit down and really breathe deeply, and maybe even go out into nature where there's a lot of trees, where there's better oxygen. Number two, sunlight is very important. Just look around nature. Things flourish when life needs sun. Number three is exercise, and exercise can be very simple. Walking is one of the best things that you can do for yourself. So if every time someone says exercise, you have a little voice in the back of your head saying, oh, it's just, you know what I mean, right? It's just like, oh, I know I need to start doing something. But just start with walking. Walking, there's no shame in it. It's one of the best things you can do with your body. And the act of doing this, it's actually, it's healing for your spine. It's moving all the muscles and all the ligaments, and everything is trying to balance back as it should when you're walking. So it's better than doing nothing. It's an awesome thing, and you can actually make it into a meditation too. So number four is nature. Well, that's the nutritional part, where there are far more expertise people than I am here to talk about the nutrition. But from my standpoint, if God made it, it's good for us. If nature made it, it's what we need in our body. If man made it, it's if it's synthetically made, we should try to stay away from it. It's you know, we do what we can. You know, we can't stay away from everything synthetic, but we do our best. So number 5 is the nervous system. What I talked about with through chiropractic. What the subluxation is, understanding what causes subluxation, learning how to deal with different types of stress, emotional, chemical, and physical. When you have an accident, deal with it properly. Learn proper mechanics of lifting, sitting at the office, doing basic things. Learn how to stretch, you know, and you know, keep fit. Number 6 through 8 are definitely worth noting, but I'm no expert in these as well. But relationship, emotional. I think the most important relationship is the one with yourself. So that's always a good place to start. Loving yourself and learning to love yourself helps you learn to love and accept others as well. Number 7, the mental outlook on life. And the most important adjustment that we can do for ourselves is mentally. If we're, as far as we usually, it's a default with us humans, as we don't like pain. We don't like anything uncomfortable. So we want to do anything to avoid something uncomfortable. So it's more like moving away from something. And that's, I think, a more powerful thing would be a paradigm shift of moving towards something that we like a goal. Instead of moving away from something that you don't like, moving towards something like a health goal or relationship goal. Making a goal and going towards that. And so that I apply that with my patients, is that they usually come with pain. They don't want to feel the pain. But I ask them, what do you want to feel? Where do you want to go with your health? And then we go towards that place. And so number 8 is spirituality. Definitely a lot of discussion around that. But basically, anything that helps bring people together instead of separate people, I think, is a positive thing. I've moved more away from religion and more towards spirituality, but lately it's hard, you know, with everything going on in the world, it's hard to kind of see any type of spirit in what's going on in the world. But we just have to, I guess we still have to have hope that there's something that connects us all. And I guess that's pretty much it. Thank you for your time. Any questions about chiropractic?
I have a personal question about your practice.
Sure.